Hi, and welcome to part two of the 7-part series about how to make your clinical documentation more effective. Today we're going to talk about accuracy. So the first thing to think about with accuracy is to making sure that you're documenting chronologically. So document in the order of what happened during your therapy session. Also making sure that what you're putting in there is factual and it's things that you actually saw happen during the session. Try not to put at this point a lot of judgment into your writing. Try to just put exactly what happened, staying very objective. Also, make it concise. So make it just what happened and not too much jargon. And make sure you're putting in there discussing the difference between what you observe and what you think it means. So in the beginning, we always document our subjective and our objective notes. We document exactly what happened. And then in the assessment piece is when we start interpreting what that information means. We're going to talk a little bit more about that later on in the series. But for now, just making sure that your documentation is accurate. You're documenting in a chronological fashion in the order of the events that happen. You're concise, you're to the point. The other thing is that it's individualized. So it helps with that accuracy to make sure that you are individualizing that note to that session instead of using the same notes for every session that you have. I know we all use things from time to time that are similar between sessions, but making sure you're adding that individual piece to your documentation so they know that you are documenting about that session. So thanks for joining me on this part 2 series on accuracy.